SJE, Farmington, New Mexico, 90.9 FM. And now 103.3 FM, translator K277CR, Durango, Colorado.
Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. It is our COVID-19 Community Information Program.
Yes.
Week 30, yeesh.
Yeesh. Week 30.
As is noted on our screen.
Yes, that's our trusty counter.
Yes, calendar lady.
Calendar lady.
Yeah. Again, I picture her kitchen, and she's just scratching the weeks away in the wall like a prison cell.
So it's 5 times 6 at this point.
Yeah, here we are, week 30, everyone. Welcome.
Welcome.
We're still here. Here
we are.
Together.
Together.
Yay. So there we go.
Co-host solidarity.
That's right. That's right. But we're glad that everyone else is with us, too, to talk about our program today on Monday. We got some great guests lined up on the show today.
Yes,
we're going to be talking about spiritual health and mental health, right?
These are 2 important compounds of what we are as human beings that we often neglect.
Thank you. I would agree.
Yes.
Well said.
Thank you.
So
I have a vested interest.
Right, exactly. So, and again, week 30, that's got to put a stressor on both of those areas of our lives, I think, in many cases. So
the indefinite.
So it's
which is what we talk a bit about that with Dr. Boswell. So.
Yes, exactly, because her interview has already been pre-recorded. Mm-hmm. Full disclosure, everyone.
Yeah,
so
hence the costume change.
There'll be a wardrobe change. So that's what's coming up. But we can get started as we await our other guest to call in by talking a little bit about the numbers and where things are today. And so we've got testing again this week here at San Juan College this evening on Monday, October 5th from 5 p.m. to 6 p.m. here at San Juan College, COVID testing happening. Wednesday again here at San Juan College in the morning, 7:30 a.m. to 9 a.m., and on Friday, October 9th, here at San Juan College in the morning, again, 7:30 a.m. to 9 a.m. So a little lesser schedule, seems to me, right? Only 3 days this week. Normally it's been 4.
4, yeah.
But again, that's what's coming up. And the Department of Health, of course, advises everybody to register ahead of time, again, at cvtestreg.nmhealth.org. Or you can scan the QR code, or you can call them at 327-4461.
That's right.
So That's the testing information so far. We'll check the other numbers here in just a moment, but our first guest, I think, is on the line.
On the line, let's do it.
So we will bring that up and push that button and say, good morning, you're on KSJE. Thanks for calling in this morning.
Hello.
Hi there. Is this Kathy Maddox?
Yes, it is. How are you today, Scott?
There you go. I am well, thank you. Thank you for calling in. Megan Cullip is here as well, and we're so glad that you are here. You are with the... Megan, help me. I wrote it down, but now I can't read my notes.
Juan Unitarian Universalist Fellowship.
That's it. Mm-hmm. Tip on my tongue.
Hi, Megan.
Hi. Yeah. That's why there's usually an acronym involved, because it's a lot of...
There's a lot. Yeah. But we appreciate you calling in because we wanted to talk with you and talk a little bit about churches and spiritual health and all these different issues that are going on now that we're in week 30, as we've just noted with our program on COVID. So
yes. So and part of it is how are these communities reopening? So
right.
I have logged on to the Unitarian Universalist Sunday morning church, and so Kathy, at what point did you guys shut down meeting in person, and at what point did you guys start reopening, and how has reopening looked at half capacity?
Well, we shut down on March 20. I think our first virtual was March 29th, and we came back on inside the building at 50% capacity on September 20th. And it has been interesting, first with the learning to do the Zoom and having it come up very quickly and all the problems with our attendance, being able to figure out how to get on. And then on September 20th, we ended up having like 4 people show up because it's something new. But we are doing Zoom at the same time, so it's becoming very integrated, and we did a little survey this week, and people are really liking the fact that you can do both. Also, with that, they were saying that because they can see the congregation through Zoom now, they're seeing that we are doing the social distancing, and we're doing the protocols necessary for us to be back inside the building, and that they really like that because it gives them the security of, if I do go to the building, it's going to be safe. And that was very interesting for us to get that feedback this past Sunday. So that is how we've been doing it.
Yeah, I think that's really wise. And I think a lot of people in Farmington might not be in tune or in the know about what Unitarian Universalism is, and so I'm not asking for like a thesis on what the beliefs are there, but can you give us just a general overview of what this denomination is?
Sure. We're a liberal religion that follows 7 core principles, and our spirituality draws from the scripture, science, nature, philosophy, along with personal experiences and the ancient traditions. So we do not have just Christians or just the Jewish denomination. We have all religions are welcome. We are a welcoming community of all people, and we learn from each other. And that is basically what we are, is we learn and we grow from the experiences of all religions and all that we know, and we just try and grow from it and learn. It's a very welcoming, freeing type of congregation.
Yeah, I would agree. And sometimes these communities are able to afford a professional minister, but how do you guys structure your fellowship?
We are actually lay-led, which means that we have a committee of program. The people in our congregation that want to actually present programs, and so we have a committee, and there's 8 of us, and so every 8 weeks, one of them, like I go on, like every 8 weeks, I will have my sermon, and it's a wonderful. It's actually very close knit. You feel like you know the person that is talking to you and trying to impart wisdom, and so the being lay led has been very, very great integral part of our local community. The larger congregations such as Durango, they have ministers that are on staff. But with us, it is a totally volunteer congregation. So this is out of the goodness of our heart that each of us get up there on Sundays and try and lead the community.
Very good. And Kathy, I had a couple of questions for you, too, about how important it is for folks to either be able to join you via Zoom or in person when they're able to do that. And for other churches in the community, too. I think, for a long time, churches were shut down. Folks couldn't go back to worship in person. And for many folks, that was really missing in their lives. And have you heard from some of your members that they really missed that part of it, or are so grateful for having these weekly connections or more than weekly connections via Zoom?
A lot of what the participants have missed is our social hour after church. That is where we get to, reconnect with each person from the congregation. People really missed coffee hour. But as for what else I have heard, it has to do with the fact that we can still see each other when we're doing the virtual services. And they're comfortable at home, and they've really enjoyed the atmosphere of being able to watch us sing, because singing on Zoom is very difficult. So they have to watch people sing. Megan has helped us with that, by the way. She's a very good singer. But now that we're in church, we can sing from the church, and they can be part of that. And what I have found that they have really enjoyed being on their sofa, being able to watch the services. So it has not been a real problem for us in coming back to church. We still do not have social hour because of the sanitary problems with that. But besides that, it's been actually very rewarding, this whole learning how to do this and being part of it and getting the feedback from everybody. We have actually had new participants on Zoom who have emailed us and said, we'd love to be part of this. So we're seeing people that haven't been there in a few years. Even new people have joined us. So it's actually been wonderful to see the new faces on Zoom.
Very good.
Because they don't have to actually travel to the church.
Right, that's true. And that was going to be my next question about that. Maybe folks, during this very trying, challenging times, have maybe been looking for a place to spiritually be refreshed or to connect with others and things like that, that maybe your church and other churches are seeing maybe an increase in participation because of just the stressful and uncertain times that we find ourselves in.
Yes, and with Zoom, you have to be invited, but we are going to be starting our Facebook, showing it also on Facebook, which is at San Juan Unitarian Universalist Fellowship on Facebook. And we'll probably be going onto YouTube also if this continues to improve, meaning the way that we know how to do this, because a lot of us don't know how to do this. So we have to learn as we go. And but we do have a Facebook page, so we will be going live on Facebook probably next week. And that, I believe, will bring in more because you don't need the invitation. All you have to do is find us on Facebook.
Very good. Well, Kathy, thanks so much for joining us this morning. I think it was great to hear a voice that maybe we don't hear as much in Farmington, and you guys have done a great job learning as you go and making sure it's safe and following all the necessary protocols. So thanks for calling in this morning.
Oh, it's been lovely, and thank you both for all the work you've done on this COVID. The information has been wonderful. You have a great day.
Thank you. You too. Thank you very much. Very good. And you got a shout out about your singing.
I know.
How about that?
It's
right?
It's awesome.
And I have to agree.
Fun.
I have to agree
Well, thank
that
you.
do have a good singing voice, much better than mine. So that's why if there was a singing part of the show, it'd be all you.
It'd be all me.
Yes.
Yeah, no, it's been
me.
fun. And I like it because in that community you can play, like, I've gotten to play Bruce Springsteen and Judy Collins and all these great artists that maybe you don't get to play as much in other religious communities, although I snuck those into the Presbyterian fold as well. So
Nice.
I'm always
See how you are.
sneaking in the rock stars.
Yeah. But that's good. Mm-hmm. You push the envelope a little bit.
Count on me.
As you're passing the envelope, and then pass the other envelope. Right?
Like tithing? Is that what you're talking about?
That's what I'm talking about. Exactly.
Oh, man.
Pass the plate. I guess that was the better term. But
Not right now during COVID. There's
no
passing
passing.
of anything.
Keep your plates to yourself and your envelopes, everybody.
Drop it off in the back.
That's right. But there you go. But I think it's important. And I think for folks maybe who are seeking out some kind of spiritual connection, they should look at this church, the other churches. We've got plenty of churches in this community for sure that I think all of them would be happy to help if some people are struggling or seeking something out. So I think that's a good thing and something to keep in mind during this, because here we are in week 30. Yeesh. That we've talked about. So there we are. So that's good. We were going to talk about the other numbers, and so we can go back to those. As we mentioned, the testing this week here at San Juan College, we have Johns Hopkins ready to go with their numbers, and of course they're keeping track on the cases here in the United States and around the world, and here in the U.S.
Yeah, so we have confirmed cases in the United States, 7,430,204 is what it looks like. It's a little blurry this morning.
Okay.
I think that's right.
Well, we had to get you sitting closer to the screen, I think.
Yeah,
so I think we're at 7,419,594 cases. Oh, 206 in the United States. You had it right.
Yeah.
You had it right.
Okay.
I'm just
a little eye test this morning.
Yeah, right. Apparently, I'm the one that should sit closer.
Yeah.
And there you go.
209,737 deaths.
That's the latest number. That's right. Exactly. And we can see again that India is right behind us, the United States, in the number of cases.
Yeah. Should I share my India story?
I thought maybe that you would. They're at 6.6 million cases behind our 7.4. So.
Yeah. And so India is a great country to test out contract tracing, et cetera, just because the sheer population, obviously it's a huge country with a lot of different states, for those who are unfamiliar with how India is broken up. And so recently they did the largest COVID-19 study. They were able to test 600,000 cases to see basically what they're testing is how does spreading actually work. And 8% of folks that get infected, it's just 8% who are highly symptomatic and who are quote-unquote super spreaders. They don't really know why certain people spread more than others.
And this is a report just for source purposes from NPR, right? This is where you're getting this from.
Yes, this is NPR. But what's really interesting is they spoke about children and how children are super spreaders, mostly because they hardly are ever symptomatic. So they're walking around seemingly okay, but they're contracting and giving the illness at the same rate as others are. And and then I also thought a fascinating portion of the study was where are you most likely to be infected? And at least in that country, it's these long bus rides or long train rides, sitting next to folks. In this closed space for a significant period of time. Right.
I think we've seen the pictures in the media from India of the just overcrowded. That's the way they get around that country, and they just climb onto maybe the outside of the train cars or the buses or things like that, and we've seen those types of things. So I can only imagine what kind of a spreading situation that could be.
Right. And they were already set up really well for this because they have been contract tracing HIV cases for so long that they're using that same model for this. So,
gotcha. But their numbers are still growing. That's a big concern.
Yeah,
in that country, and it's a poor country.
It's 100,000 cases per day.
Yeah.
So it's kind of a mixed country. Some states are wealthier than others, but
sure. But overall, I would say it's certainly a poorer country than
developing
the United States.
Nation. Oh yeah.
Right. So
yeah.
Comparatively speaking, so there you go. But interesting about the children. So.
The children.
Well,
we know that they're spreading all sorts of diseases. That's the thing with kids.
Right.
It's harder to get them to wash themselves, etc., and be careful.
Right.
They're not exactly wired.
Well, and if they're not symptomatic, that's another issue, right?
You have no idea.
That's right. So there you go. Okay. Well, thanks for that. That's interesting. Thank you for listening to NPR. Appreciate that. Let's talk about New Mexico numbers.
Okay.
Again, we're pulling this off of KSJE.com. This is coming from the New Mexico State Health Department. These are the latest numbers as of Sunday. We had another 189 new cases yesterday reported. That's actually down from what we saw over the weekend. There were very high numbers over the weekend, daily cases probably in the 280 area and things like that. So this is lower than we had seen, but we're now at 30,477 cases in New Mexico, 8 new cases in San Juan County. And I must say, with all the big numbers from the state, San Juan County numbers have been fairly low like this, single digits, low double digits. Again, I think we're still doing a really good job here. It's the other parts of the state that are a little out of control, and that's what's pushing up the statewide numbers. So that's what's happening there. 2 additional deaths in New Mexico. One of those here in San Juan County. So we've now had 200 people who have died from COVID-19 in the county. 60 new recoveries. We're now at over 17,000 across our state.
Cool.
So that's the latest numbers there. And again, there's more detail at the cv.nmhealth.org. You can check that out. And in other news, the Navajo Nation had a total of 19 new cases reported over the weekend. They're now at 10,441. 1 additional death for a total now in the Navajo Nation of 559. And of course, their 57-hour weekend lockdown is just about, ended this morning at 5 a.m. So, but they did that again to try to keep their numbers where they need to be.
Yeah.
So that's a good thing too. So there we are. So there's that about those numbers. So very important.
Yes.
Shall we go to our other interview
Yeah.
in just a moment here? Let me try to find it here. Not that we don't have it. We do. Don't worry about that.
Yeah. How much we're going to have to dig here.
Right. Let me find it here. Here we are. This is, again, Dr. Ava Boswell from San Juan Health Partners Behavioral Health. Joining us now to talk a little bit about behavioral health, Dr. Ava Boswell is back with us from San Juan Health Partners Behavioral Health. Dr. Boswell, good morning. Thank you for calling in today.
Thank you so much for having me. I greatly appreciate it.
You bet. It's great to have you back on the program, and we wanted to bring you back to talk a little bit about behavioral health in the community. Of course, I know students and parents are dealing with this virtual learning, and I know a lot of students would rather be back in the classroom face-to-face with their teachers. Do you have any advice for maybe students on how to deal with that and parents on how to help their students deal with that?
So one of the things that I've seen the most that's happening with the kids that I'm treating is that kids function really well on schedules, and parents do too, actually. Everybody does. But what virtual learning has done is it's kind of taken the schedule away, because a lot of kids don't have to get up at the same time. They don't have to go to bed at the same time because they don't have, they're getting up to go to their living room or to the kitchen table to do school instead of getting up and getting dressed and getting in the car to then go to school and see their friends and have the social engagement. And so what's happening is that the kids they don't have the same social engagement, they don't have the same schedule, and they are getting more depressed and more anxious. And sitting in front of the screen for a longer period of time than they would if they were in class is also really taxing. And so what I've been suggesting to a lot of my parents is that keep your kids on a schedule. Have them get up at the same time they would, when they normally would get up to go to, in-person school. Have them get up and get dressed, eat breakfast, then get yourself on a daily routine with whatever classes they have and the homework so that they stay in that routine so that when they do go back in person, that you don't have to kind of like recreate the wheel. And the schedule actually helps keep them on track with their assignments so they don't fall behind. And it keeps them in a routine so that they just have better time management skills. Because in some cases, kids are actually attending their classes like in their pajamas from their bed, and then getting more and more depressed, and then having to seek care, which is it's a kind of a vicious cycle. So keeping the schedule going and is the best option that I have. My best recommendation for parents.
That makes a lot of sense, and I know for some students, of course, they are going to school face-to-face some days a week and then being at home other days of the week. So that sounds like that would work really well in those situations to just stay on the same schedule, whether you're catching the bus or just turning on the computer.
That is very definitely true. If you have a schedule on Monday and Tuesday where you go to school, if you can do the same schedule Wednesday, Thursday, Friday, the days that you're off, it will make going back the next week much easier, and you won't fall behind in your studies and the lectures and the homework, which is happening. And, we want our kids to succeed, and so keeping them on that schedule is really important.
Great. And I want to ask about, well, it's a two-part question. One is we are dealing with a time of indefinite uncertainty, I would say, and which is somewhat of what you're speaking to about these schedules and such. But what about these other basic exercises, maybe like deep breathing, some type of walk, sometimes of like tactile things? What is your advice on that front?
For the first question, the indefinite uncertainty, it's a really hard topic, and it kind of leads into the second part of it. Indefinite uncertainty leads to increased anxiety. It leads to increased distress and depression. Some people, it leads to insomnia. And so all of those are risk factors for depression, anxiety, having to seek treatment, in some people even to the point of having suicidal thoughts, things like that. So the indefinite uncertainty, I recommend to my patients who are very anxious and becoming depressed in this situation, is that they really have to find the ground themselves to where they are. And you can't control tomorrow or the next day, but what you do have is right now. And so really focus on what you have right now. Be thankful for that. Some of the techniques are, taking deep breaths. And there's what's called 4x4 breathing, where you breathe in for 4 seconds, you hold for 4 seconds, you breathe out for 4 seconds, and then you do a cycle of 4 breaths. And basically that helps reset your nervous system. And if you have to do it more than once, do. The other thing is taking space for yourself. And what I mean by that is literally physically taking space. If you're having anxiety, if you're in a situation that, might be more stressful than normal, where you may get irritable, separating yourself from the stimulus that's causing the issues, stepping away from it, and even taking just 5 minutes outside, 5 minutes in the bedroom, 5 minutes in the kitchen, where you're not around whatever is triggering you, is a really good way of kind of resetting things, and then being able to come back with like a really calm mind and calm presence to whatever the situation is. And especially in dealing with kids who are upset about schoolwork, as a parent, taking that 5 minutes away can really change the interaction with the child or with the kids. Other things are really focusing on self-care, and what I mean by that is exercise, eating right, getting good sleep, staying on a good sleep schedule, and also engaging in the activities that you enjoyed previously. Because a lot of times, especially during this very definite time of uncertainty, we have a tendency to distance ourselves from the things that we used to love. A lot of people, for example, loved sports, and getting back into like physical activity in sports is harder with like the social distancing requirements. But at the same time, being able to find some kind of an activity, a sport that maybe you do, maybe it's tennis instead of playing basketball, so that there's more distance. Maybe it's running instead of playing football. So something that, you are getting out, you are getting exercise, and you're getting sunlight. Those things are very important for self-care.
And I wanted to ask you one more question about students and parents. And that would be, for maybe students who have been, honor roll students, 4.0 students in their face-to-face classes, and now they're on the computer and their grades are just crashing, and parents are concerned, and students are stressed, and parents want to help, but they don't know how to help. Is there any advice that you may have for that type of situation that could be so very different from what that family is used to?
Digital learning and online learning is so much different. It's a different format than in-person learning. So that has caused significant problems in kids who have succeeded in the classroom. And there's a learning curve to learning how to learn in a digital format. And so number one is being really patient as a parent. Number two is really finding out where the struggle is and looking at it in depth and saying, why is my child struggling with distance learning? Is it that they don't focus well on the screen? Is it that there's more distractions at home? Is it that the workload is higher? Is it that they don't understand the material? And really try to dissect out what the issue is that's causing them problems. And for a lot of parents, and especially some people who are have just graduated from high school who are going into college, I found that this is a pretty significant issue because they've done really well in high school, excelled, and then end up in college and they've bit into, online learning, and they're really, really struggling. And so in that situation, I've suggested, breaking it down into what is different about this. And, a lot of it is maintaining focus for a longer period of time, not being able to get up and move like you would in a classroom, that you've got the sustained attention on a screen for like 40 to 60 minutes, which is actually really hard when our attention span isn't that long. And we're not using pen and paper and books in the same way, and a lot of it is PowerPoint, and people don't retain the information as well from PowerPoint. So it's figuring out how to translate the information into a format that you can study and work with. But breaking down the learning steps is really important, and understanding where your child is having problems.
Very good. Thank you.
Great. And so we have one last question here, which is related to the suicide problem. And I know this is pretty complex and there's a lot of gradations and stuff, but when it comes to suicidal ideation and plans and such like that, when is it outpatient, seek immediately, versus crisis center, emergency room?
Okay. So the first step is really identifying what step the person's at. Are they depressed? Are they anxious? Are they distressed? And how severe that is. Then asking the questions, which are difficult questions, of where are they in this cycle? Is it that they're just feeling very hopeless and helpless? Or have they moved from the hopeless, helpless stage to thinking and contemplating suicide, or having passive thoughts of that the world would be better if I just wasn't here? Or has it moved from that thinking to this is what I would do to hurt myself? Or to the next step, which is much more critical, of this is what I'm going to do and this is how I'm planning. And then the next step from there is that they're collecting whatever method they would do to harm themselves. So it's really identifying where they are in the process. If a person is having depression, anxiety, like step one would be a time to seek outpatient help, because that person hasn't gone through the other steps. If you get to the point where someone has thoughts about harming themselves and what they would do to harm themselves, that becomes like a gray area of they could be treated outpatient if they had close outpatient follow-up and close family support. If it becomes to a point where the person has active thoughts that they are going to hurt themselves multiple times a day and they have a plan, there's no question they need to come into the hospital. So that is where, if there's any question at all, the person really needs to be evaluated by either a psychiatrist or a mental health professional, an ED physician, urgently. And so I always suggest that if there's any question at all, it's better in these situations to be safe than it is to be sorry. And that's why these services exist.
Absolutely. Very helpful. Thank you so much. And thank you for coming on to our show, Dr. Boswell. We really appreciate it. You've given us a lot of helpful advice.
I do want to stress that at any time there is a suicide hotline. It's 1-800-273-TALK, and that's available 24 hours a day, 7 days a week. And it's for anyone who's having thoughts, concerns, and they can definitely help you get into services. There's also our San Juan Behavioral Health, which is 505-609-6680 to get into care. And then, no question, San Juan Behavioral Health and the ED work together really well. So, if you have any questions, come on into the emergency room. And thank you so much for the time. I greatly appreciate it.
Thank you, and thanks for your advice. And again, we really appreciate your expertise in this very complicated situation. So thank you again.
Thank you. I appreciate it.
You're very welcome. And there we go. We appreciate Dr. Boswell coming back on to talk with us about this, as we mentioned, important information, because I know a lot of folks are struggling, kids are struggling, and so we really hope that they will reach out to these resources that she mentioned, and we'll put those on our Facebook page as well, everybody. So
agreed.
Good information.
Spiritual and mental health today. That's
yeah,
good.
right?
Good.
Important, very important. And so that brings us to the end of our show for today. Looking ahead to Thursday, we are planning to speak with some more of the medical doctors about some of the new things that we're hearing about treatments and things like that. Of course, certainly whatever the happening with the president by then, when we have an update about that. But thoughts are with him and the family and the other folks in D.C. who've been maybe testing positive, and so we're thinking about them. But then also on Thursday, we're going to talk to a parent who is concerned about school and virtual learning, and that's not going well for many kids we know in our state, in our community, and so he has been very vocal about that, and we're looking forward to hearing from him coming up on Thursday as well.
Yes, look forward to it.
So there you go. Until then, though, everybody, that's it for us today. Stay well and stay safe. Wash your hands, and we will see you back here on Thursday. Bye-bye.